This episode of Fertile Talks is sponsored by ilmeds.co, an international mail order pharmacy specializing in fertility medications. If you're looking to save significantly on your fertility treatments without compromising on quality, ilmeds.co is an excellent choice, offering up to 80% of retail prices. And as a special offer to our listeners, use the code FT24 at checkout to receive a $50 discount on your order. For your convenience, you can find a link to their website in the episode show notes. Thank you, and let's get started. Welcome to Fertile Talks, the global podcast celebrating the diversity of fertility journeys. I'm your host, Dr. Yemi Famuyiwa. Whether you're just starting or simply curious, this is your safe space. In each episode, we will bring you expert insights, heartfelt personal stories, and the latest in reproductive health. Our goal is to break down barriers, tackle stigma, and provide support and hope. So, whether you're in the Americas, Africa, or Asia, Fertile Talks is your companion on the path to parenthood. Thank you for tuning in and welcome to Fertile Talks. The topic of the day is egg freezing. And let me start out by saying egg freezing has really become an empowering option for women. However, I want to also mention some of the things that most people may not be aware of. There was a recent article in Fertility and Sterility Journal this month that was entitled Setting Appropriate Expectations. So let's dive into this. This means you need to understand what the possibilities and limitations of egg freezing are while recognizing the role that lifestyle choices may play in enhancing fertility. So, what does the process of egg freezing look like? Well, your eggs are usually located inside your ovaries. They're located in what are called follicles in an immature state. And the process of when the eggs are being stored in your ovaries, they are woken up, if you will, by your brain in waves. So you get a batch of eggs recruited. The brain will select one to ovulate, and it will take that batch and it will toss it aside. So there's a process of egg loss every single month that you are alive, right? You may start out with about 20 million eggs when you're in your mother's womb. By the time you're born, actually, that goes down to about 4 million. By the time you start having your menstrual cycles at age 12, 13, whatever age it is, there's further loss down to about 200 to 300 or 400,000 eggs. Then each month, those eggs that are left are woken up, if you will, in waves, right? The brain is going to initiate this. And I'd like to refer to this wave as a basket of eggs. So the brain wakes up a basket of eggs, selects one to ovulate, and it's going to toss aside the rest of the basket. In other words, whether or not you like it, you constantly use eggs. Egg freezing is the process of trying to capture the basket that's going to be tossed anyway, right? Before they are tossed. And egg freezing depends on also the quality, the age at which the eggs are frozen. Now, as you live, your body is exposed to environmental toxins, what you eat, age. So your eggs start to get older. They don't fertilize as well, right? The DNA machinery that's causing the DNA division in the egg doesn't work as well. So that's what we mean by trying to save the ones that you have now that before they are exposed to further damage. And I'll allude to that and talk to it about. So you're going to take this basket that's being recruited, and you're going to prevent the brain from selecting just one, right? We manipulate the brain, hormones. And you want to stimulate this basket and monitor the growth of the entire basket. So as you stimulate, the follicles start to get bigger and bigger. with the expectation that the egg inside will get more mature. This process takes about 10 days, plus or minus 1 or 2 days, and you are monitored by ultrasound to measure the growth and by blood work to see the response. As the follicle gets bigger, the cells surrounding the eggs, called the granulosa cells, produce the female hormone estradiol, and um, as your follicle is getting bigger, they produce more estradiol. So we can actually also measure the estradiol, and it helps us in making sure that we're monitoring appropriately both the growth and the maturity of the eggs. When the follicle gets big enough and we can see it on ultrasound, then we give a trigger medication, which sort of loosens the egg inside the follicle. You don't want the egg to come out, you want to get it, but you loosen it up, and then the eggs are collected. How is that collection done? It's usually done under some form of anesthesia. I usually tell my patients, almost like sedation dentistry. You're put under sedation. You got to breathe on your own, so we're not going to intubate you. But we use anesthesiologists in our facility, and they will sedate you. And while you're sedated, so you're not in pain, the retrieval is done by inserting a vaginal ultrasound probe and inserting a needle through the probe into the ovary. Most of the time, unless you have scar tissue, the ovary is actually located very close to the apex of the vagina in the back. So it's very easy to get access to the ovary. The process of retrieving those eggs typically takes 10 to 15 minutes, and then you're done and you're waking up, right? So that's what to expect for the whole process. And then the eggs are handed over to the embryologist, who's going to clean them off, separate out the granulosa cells, and then freeze them, right? In a process called vitrification. It's more like a flash freeze. The eggs were challenging to freeze many, many years ago, but now the technology has evolved where we can freeze them um, better than it used to be. And that process is called vitrification. And we'll talk a little bit about what happens right after you try to thaw them. What is the financial cost? Well, that sort of depends on where you are, what clinic you go to. Most egg freezing, it depends on where you are in the country, can be anywhere from 5, 6,000 upwards. I hear in some places 10,000, 12,000. In addition, you have to buy medication. Now, medication can run a few $1,000s. So you really want to know where you are. You want to really shop. We tend to shop around a lot for our patients in terms of where to get their medication to make sure they're getting the best price possible. How can you make it budget friendly? It depends. We are in a state that's mandated, so we're starting to see more and more coverage by insurance plans. And recently, I understand that um, Medicaid, even in the state of Maryland, is offering coverage for cryopreservation of your eggs. So it kind of depends on where you are. You want to do your homework. You want to sort of get a scrapbook and start taking notes, call around, check the prices, and also make sure that you're comfortable with the clinic you're going through. But I would say I'm starting to see a lot more coverage. And then there are some um, work benefit plans available. More and more companies are starting to pay for their staff to get this done. All right. Is there a certain age at which you should freeze your egg? Typically, the ideal age is from age 25 to 35. Sweet spot is 32. Um, Maybe younger if you have issues such as endometriosis. I've had patients who've had to have chemotherapy, breast cancer patients, and we had to freeze their eggs as soon as possible so they can go get their chemotherapy. And we know those patients um, can preserve their fertility and use them in the future. So, um, one of the things you want to understand is the age at which you freeze your eggs really will determine whatever success you get in the future. Because as I have explained to you, your eggs, as you're exposed to life, right, as you go through life and exposed to different toxins, the egg starts to age and it gets harder to fertilize them over time. One of the things that you can do to help yourself, I always tell my patients, your eggs are as healthy as your body, right? What do I mean by that? Your lifestyle choices play a key role when you're preserving your egg health, right? So you want to reduce oxidative stress through proper diet, eating leafy vegetables, making sure you're eating, berries, nuts if you're not allergic, avoiding smoking and excessive alcohol. And now we now know that marijuana may actually have a negative impact on egg quality. So for those of you who do that, you might want to cut back that on that. Maintaining a healthy weight also reduces inflammation and oxidative stress in your body. So those are the things that you can do to help yourself before you even consider freezing your eggs. So, what are the advantages and disadvantages of freezing your eggs? So, I think egg freezing provides you reproductive flexibility. That's the whole point. It gives you flexibility, allowing you to delay childbearing, while you're for medical reasons. For instance, I explained to you my patient who needed chemotherapy for personal reasons. Maybe you want to find the right person, or you just don't want to take the gamble that when you do get ready to have children, maybe in your 40s, you may not have enough eggs left, and the eggs you have may not be as good. I guess it gives peace of mind. However, you need to be very careful and set the right expectations for yourself, right? I refer to this article that just came out. I think that it's not a guarantee. So we can't really say it's providing an insurance policy because that leads to people thinking, oh, I can freeze my eggs, everything's going to be fine. And when I come back later on, um, I'm going to be fine. That's not the case. According to this article I'm talking about, they looked at women over 7 years, and the study was done in multiple countries, not just in America, South America, in Chile, in the U.S., in London, in Belgium, in Israel, and I think a few countries in Asia as well. And there were certain trends that they noticed. For instance, in the 10-year span, I'm sorry, in the 7 year span that they looked at, really only about 10.8% of people came back to use their eggs, right? That's number one. Number two, not all eggs will survive when they're thawed, right? About 81% actually survived. Of the eggs that survived, about 31% resulted in a clinical pregnancy, but the live birth, take home baby rate was about 28%. And per egg, the live birth rate was, I think, about 3.4 in this one study. Some people quote 4% per egg. So it's not a one-on-one. There's something we call an attrition, a loss. Not every egg will freeze well. Not all the ones that freeze will survive the thaw. I just told you that. Of the ones that survive, not all of them will be fertilized well. Of the ones that are fertilized, not all of them will develop into a full embryo, a blast. Of the ones that do develop into a full embryo, not all of them will result in a live birth. So be careful with setting the right expectation. Understand the pros and cons. One of the things, I'm going to keep saying it again, is to try to maximize the quality of your egg before you consider freezing. And we talked about this, right? It's, making sure your lifestyle, what you're exposing your body to, makes a huge difference in the quality of the egg that you get and the result that you expect later on, right? What is the emotional toll, and is there support available? It is a very emotionally taxing thing to go through, right? Taking medications, injecting yourself, hormonal medications may affect mood, and the uncertainty of the outcomes may lead to anxiety. So I think it's important to build a strong support system through counseling when going through this, through support groups, and also again we talked about making small lifestyle changes, such as maybe mindfulness practices. I think most people that are going through this should seek out clinics that may also provide resources that will help you navigate the emotional toll of the process, is what I would say. What happens if you don't use them? You can certainly discard them. You can donate them to other couples that don't have children. You can donate them for research. So I think that you have to make that decision with in conjunction with your physicians, with the clinic you go through, and make sure you have proper counseling to decide. One thing about egg donation, if you donate, I always explain to my patients, you have to be aware that most donations are not so-called anonymous nowadays. They could be anonymous, or you could try to make them anonymous, or you could be upfront. I have donors who may say, "I want to know who the family is that my eggs will go to." I mean, it's their right to know. So if the intended parents are willing, we do definitely facilitate that. And for those that choose to remain anonymous, I always explain to them, just because you choose to be anonymous doesn't mean you will be anonymous, right? As we all know nowadays, yeah, everybody has 23andMe. The kid could grow up and go through 23andMe, and whatever kids, you guys know what kids do nowadays, and through social interaction, somebody knocks on your door 18 years from now and said, "Wait a minute, the egg that created me came from you." How do you feel about that? You need to know that. So our donors, if we get them, they go through psychological counseling. You have to be comfortable with that, right? You have to ask yourself, why are you doing this? You have to have a desire to help, and you have to be comfortable with that. And if you cannot answer those questions, maybe you're not a good fit for donating your eggs. In which case, if you don't use them, you can always discard them. How long can you wait to use the eggs? And do you have to be implanted by a certain age? Well, the process of vitrification really allows for your eggs to be stored indefinitely, right? But success really depends on the age again, the age at the time the eggs are collected, the age at retrieval, and the health at the time that you're going to use them, right? If you're sickly, if you have diabetes, high blood pressure, um, um, that give you a good outcome. Most places in the US usually recommend using your eggs sort of by age 50, and that's because you start to get into pregnancy at an older age, which becomes a high risk pregnancy and has attendant complications, right? So, again, trying to stay healthy throughout would help. So when you go in to use them in your 40s and you're healthy, that's good in optimizing your outcome. All right, what is the one thing you should know about egg freezing? Egg freezing is empowering, right? But it is not a guarantee, right? So the article I was explaining to you talks about attrition occurring at every step, from thawing to embryo development to implantation. And so that's why it's really critical to set realistic expectations. At the same time, I do encourage women to take proactive steps to help protect their fertility, right? So healthy eating, regular exercise, stress management, avoiding toxins are simple but impactful ways to support egg quality and overall health. Um, and these help steps can help complement any medical intervention like egg freezing, giving women more control over their reproductive future. Thank you for tuning in to Fertile Talks. We hope today's episode has provided you with valuable insights and support for your fertility journey. Remember, you are not alone. Now, if you have any questions or topics you'd like us to cover, please simply leave us a comment. And please don't forget to like, share, and subscribe with a friend. Your ratings, your shares, and your reviews are greatly appreciated and is going to help us serve more of our listening audience. Thank you once again. This is Dr. Famuyiwa.